Thank you. And I call Emma Harper to be followed by Brian Whittle.
Thank you, Presiding Officer. It's always interesting to be one of the last speakers in the debate and hear the contributions ahead. And so I've got loads of scribbles over my paper as I've made little comments. As a nurse, I've got experience working with people who require help to address their problematic use of alcohol and drugs. And I agree with Tom Arthur that he's mentioned that many of us across chamber will also have direct experience and knowledge of people that have had problem use as well. It's a complex issue requiring a multi-team and key partners and a person-centred patient rights approach. And I welcome the new Rights, Respect and Recovery strategy, which aims to prevent and reduce alcohol and drug use, harm and related death. In today's debate, I'd like to focus on two aspects: social prescribing and safe consumption rooms. Presiding Officer, the Scottish Government's alcohol and drug treatment strategy, unlike the succinct proposal by the Tories, has a person-centred approach so that treatment and support services address people's wider health and social needs, such as mental health, employability and homelessness. In the last 10 years, our understanding of the underlying causes of addiction and substance use disorders has changed and developed. The Scottish Government now recognises that deprivation, poverty, trauma and adverse childhood experiences can cause people to seek alcohol and drugs, which can lead to problematic use. And while there are clear differences between the root causes and the response by services, they have too much in common to be kept apart. Treatment can no longer be clinical, but must also address some of the deep-rooted social and economic circumstances that people face. It is fundamental that we address issues such as social isolation and stigma that others have mentioned, and these remain major barriers to recovery. The Scottish Government's renewed approach, along with the introduction of minimum unit pricing for alcohol, show a range of measures that this SNP government is taking to help people with problem use, and that devastates lives and families and communities. I spoke with a former colleague yesterday who's a nurse specialist who supports people experiencing problem drug and alcohol use. And she said anecdotally that the minimum unit pricing is actually working. Her client cohort are consuming less of the high in alcohol drinks that the minimum pricing strategy is targeted at. So I welcome future evidence that's going to be presented by the government when we see the actual numbers or the effects of that policy. Sure, I'll take an intervention.
Rachel Hamilton.
I thank Emma Harper for taking the intervention. You're talking about the evidence that the minimum alcohol pricing will eventually give us as to whether people are dropping their levels of alcohol consumption. Would you also agree that with regards to reducing drug deaths, there should be clear measurable targets?
Emma Harper.
I think we're talking about patients' lives here, and I think the ultimate first goal is saving people's lives, the right to life and the right to support people through any health care problem that they have. And first and foremost, I have said previously in this chamber, we need to stop treating drug users as criminals, and instead we must look at illicit drug use as a public health issue. So it's actually good to see that the Tories are finally catching up with the public health issue in their document that they presented, and I welcome that. But unfortunately, in terms of the law and drug policy, as we've heard, we're reliant upon an out-of-touch government to take decisions on our behalf. And I would suggest that the members opposite should lobby for powers over drug laws to be devolved to the Scottish Parliament. And I know others have said that it's a UK-wide issue, but the Scottish Government do have a goal to address this. And using laws that are 47 years old really need to be challenged, and we need to be addressing this.
Would Emma Harper take a brief intervention?
Yes, of course.
Stuart McMillan.
I thank Emma Harper for taking the intervention. Certainly, subject to the comments from Michelle Ballantyne earlier regarding having a whole system mapping strategy, would the devolution of these powers actually help with that?
Emma Harper.
I would welcome any devolution of any powers, and I think that if we have an idea and a plan to treat people with rights, respect and educate them or help them to support a recovery strategy, I would welcome any devolution of any laws. We have 200 community and residential rehab centres in Scotland, and although these centres can help, there's an average of 70% of people who come out of treatment that revert to problem use within 6 months. I find these numbers quite challenging, but earlier this year I attended and spoke at the opening of the River Garden, which is the Independence from Drugs and Alcohol Recovery Community, which is in Jean Freeman's constituency. So it's interesting to hear that Annie Wells has actually visited that centre. It's a recovery community, Independence from Drugs and Alcohol, or otherwise known as River Garden. They apply a social prescribing approach to recovery, and it applies the San Padrignano, which is an Italian recovery model, which looks at one of the oldest, longest running successful residential treatment centres. It's been working for over 39 years and it achieves full recovery for persons with addiction support. I realise time is short and I would support social prescribing issues, and I would welcome the Minister's thoughts on supporting these social prescribing models such as the San Padrignano one at River Garden. Presiding Officer, I would be happy to continue debating on, but I realise time is short. So I support the Scottish Government's new strategy and reaffirm the calls from the SNP for powers over drug policy to be devolved so that we can really take action and support our people and save lives. Thank you.
Thank you very much.